Here we are in Vida en Espiral, live in Spiral in English, with your host, Claudia Simasek, where we'll maintain pleasant themes and conversations. Just get comfy and enjoy. Hello, and here we are in Vida en Espiral, live in Spiral in English. And today I have a very special guest with me, which is a person that, besides of all the things that we are going to say about her, is also my dearly friend for more than 10 years now, right?
Yeah.
It's Nicole Kabia. Dr. Nicole Kabia. She's a doctor in physical therapy, also dry needle certified, a belly dance instructor, and orthopedic and pelvic floor specialist. So welcome to Vida en Espiral, Life in Spiders in English.
Thank you so much for having me. I am so excited to be here, Clau. I love what you're doing with this podcast, and I'm so excited with all the conversations and things that we do. So I feel honored. Thank you.
No, I feel so glad that we finally do this. And we are going straight to the point because
Okay.
one of the things that make me feel admiration and I always has been excited is about your job and the benefits that have your job with the people. And like the pelvic floor, especially is an orthopedic area, is something that make me feel passionate about it because also being a doula, and there's a lot of work that the moms can benefit. And today we are going to move in that direction and then other things that I want that the people know about you.
Okay, sounds great.
Yes.
I'm excited.
So first of all, how did you end in that field? Or make you go to that field?
So when I was in undergrad, I was my freshman year. I was still trying to figure out what I wanted to major in. And I knew I wanted to minor in dance just because I've loved dance my whole life.
Mm-hmm.
So I was in a dance class. It was a modern class. And I was talking to one of my classmates and she was like, we're talking about majors and stuff. And I was like, I have no idea what I want to do. And she was like, oh, well, what do you like? And I was like, well, I love dance. And I actually really love learning about the body. And she's like, well, you should look into physical therapy. And I did. And that was literally it. After that, I totally fell in love with the field and helping people because I love helping others. So yeah, I kind of just pursued it from there. And then, I went to PT school at Duke. And then when I came out of PT school and got my doctorate, I started dancing at Mamacita's.
Mm-hmm.
That's where we met.
That's where we met.
And so honestly, it was dancing at Mamacita's that really got me into pelvic floor physical therapy.
Wow.
Yeah, I knew I wanted to do orthopedics. So I started doing a fellowship to learn more about like just, some of the manipulations and stuff, the hands-on stuff. But taking Dr. Sunyata Amen's classes really helped me understand the connections of the body through dance and the healing of the body through dance. Like every other dance form I had ever done was really just more like, like the Western dances of like modern, jazz, tap, stuff like that. But when I was introduced to belly dance, I was like, this is it. Like, and it connected all the dots from what I had learned in school. And now what I was learning in dance, I was like, this is like the perfect mesh. And so when I saw how much the pelvic floor really played a role in a lot of our issues, that's when I decided to go down that path. And that just like opened a whole new world to me.
Wow. And people don't know that I have known you for more than 10 years now.
Yeah.
And I didn't know the importance of PT till I met you.
Oh,
because I have seen you working with your clients and you have worked on me in different stages of my life. For example, before when I was just dancing with you, and then while I was pregnant, and then postpartum. And for me, it was mind-blowing knowing so many issues that we have that are just linked with the movement and the shifts of the body.
Yeah.
And then I learned when I was doing the certification for doula, the training for doula. And then, first of all, I learned it later because you have worked on me
Mm-hmm.
And I didn't know how far physical therapy could go with people.
Yeah.
So, like, I will tell from my experience in my first pregnancy, you work on me because my sciatic nerve was really bad.
That's right.
And that was one of the things that for me, I thought that I was messed up for life. And you just work on me, and that was released. And for me, was like a miracle.
Yeah. It's true, because like we don't realize how much our body changes, and so many women go through exactly that pain with the sciatic pain during pregnancy, and they're told it's normal, and it's just like the pain that you're supposed to deal with, and that's so not true. Like, there's so much we can do.
And what's shocking to me is that I went to the doctor and they just gave me pills.
Yep.
They not even recommend or refer me to a physical therapy.
Yeah.
And when you work on me, I was like, this should be available and should be known for everybody.
I completely agree. It's really, to me, it's like, it's bittersweet, because I love what I do, and I feel like a lot of women don't know that there's stuff that can be done to help. And the way our healthcare system is set up, a lot of times they don't get referred to physical therapy. The good side is there's been an upward trend of doctors referring to physical therapists for prenatal and postpartum care, but it's just like, making sure everybody gets the word out. Yeah.
Wow.
But yeah.
That was a major discovery, knowing you and seeing you in the field, because I have seen you working with people in front of me, and it's very like just a movement or whatever. It's like, yeah, you release. I'm sorry, but also about the pelvic floor and everything, all the things that are linked to our health, and to things like incontinence or like menopause that are linked to the pelvic floor. Can you talk us a little bit about it? Because
yes, we might be here a while.
I know, but I need that the people
so
know, because women don't take care about that. Women don't talk about that. They suffering while they are pregnant, postpartum, and then so on.
Yes. So you're absolutely right. There's so many things that just as women, we don't know what's going to happen in our bodies, and there's not enough invested in educating us about it. So like, even with like pregnancy, a lot of people don't realize that like, as your body's shifting and changing, your body's giving you all these new hormones, which affect both physical, but mental and emotional. But what happens physically is that you get this relaxin hormone that literally relaxes the ligaments, the muscles, and the joints so that your body can expand while the baby's growing. But what also happens that comes with that is constipation.
Oh, wow.
And back pain. And, our breasts get enlarged. So then we end up getting like neck and shoulder pain. So all these things are connected. And then we have a baby. We don't know what we're getting ourselves into during that labor and delivery process. I mean, to this day, I still feel like there's so much more to learn. But the way that our bodies are so magnificent in being able to like totally transform to provide life into this world is like astounding to me. And I don't think women understand the importance of the rest that comes afterwards. Like, our society does not allow us to rest. And that's how the body heals. Like, you just had this huge transformation, like a butterfly.
And that was another thing that I was telling in another podcast, that people have the misunderstood that postpartum is just a month, 3 months, at the most 6 months. And you are postpartum till the time that you unwind that baby.
Yeah.
And your body,
you
stop the breastfeeding, and you are still segregating hormones that from the breastfeeding and everything affect your body. Yeah. And the massive pushing for you to work and be productive and keep growing when you are nurturing a baby is insane, especially in this country.
Yes, 100% agree.
And those things, we had this conversation many times.
Yeah.
And those are the things that I feel like women don't talk a lot about it. I know that there are
Yeah.
a lot of moms group that try to help you psychologically and emotionally, but physically it's like you cannot help it because the world is running so fast
Yes.
that you cannot stop, and you feel behind because everybody is like pointing at you. You should be working. Why don't you work? Why don't you stay till late? Oh,
Yeah.
you can do that at 11 in the night or
Yeah.
whatever, and you come from that habit
Yep.
without having enough rest, enough like sleep
Support.
time,
Yeah.
get pregnant, have a kid, and you're still with those habits, and everything is building up.
Yes, and I honestly think that's why the postpartum depression rate is so high,
Mm-hmm.
because there's just not enough support. And like your body just physically like just completely
Mm-hmm.
changed, and now it needs time to come back together. And if you're up moving around, that's where a lot of the issues come in with incontinence, prolapse, all types of things, pelvic pain. There's so many things that we just don't know or don't talk about. And a lot of times women postpartum are told, oh, it's 6 weeks, you can go back to all your activities and everything. But if there was any type of tearing, if there was any type of surgery, like we haven't even talked about C-sections,
Yes.
being an entire surgery, and one of the few surgeries that you don't have any type of rehab for. Like you're told, oh yeah, you just had surgery, go have a baby, like go take care of your baby now. Like you're not taught how to take care of the scar. You're not taught how to retrain your core. So a lot of what I do with postpartum moms who come to see me for physical therapy, it's like your body just had this big transformation. Mm-hmm. What your body's doing is very similar to the developmental stages of your child. Mm-hmm. So your baby just got here and they're breathing and sleeping.
Yes.
You're supposed to be resting and breathing and reconnecting to your core because everything's been shifted. Oh, wow. So as babies are going through their stages, so do we with the exercises. But yeah, I feel like, and then that's not even touching on other, like you mentioned, menopause, right? Yes. That's another major shift in hormones for women. And what we always think of is, oh, okay, our cycle's done. That's it. And there's so much more to it.
Can women in menopause can do some sort of therapy for prevent issues that are normal from menopause?
Absolutely. So with menopause, your hormones drop too, including your estrogen. When you don't have enough estrogen in your body, it actually affects the tissues of the vulva. Oh. They get thinner, they get drier, so pain, more likely to have pain with intercourse. You're more likely to have leakage because those muscles just don't have the elasticity to work and function. So there's different ways to help address that, including pelvic floor therapy, but honestly, belly dance. I feel like belly dance is like such an amazing way to be able to, and fun, to find those muscles, connect to those muscles, and feel like a woman again, because I think that's a big piece that we lose also during all these transitions.
That is another thing that I want to shift the conversation, because I have noticed, like, we teach together. We are part of a group together. We have been dancing together since 2014. Mm-hmm. And something that is amazing to me, how you combine in the class, when it's your time to warm up or warm down or teach a class, how you take a lot of care of the body of the students and us. A lot of modifications for people that have knees or ankles or whatever injured, but also like giving us little explanations of the movement and how are related with the pelvic floor. Yeah, that has been for me always amazing, because I learned dance, for me is natural too. Yeah, and I always been in the dance world forever. Mm-hmm. But knowing that there is also a healthy reason behind make you feel more in love of the dance.
Yes. And that actually came from Dr. Sunyata Ahmed,
Yeah.
because she would give us these little snippets. And when she would tell us, oh, when you're doing these contractions, you're massaging your kidneys, you're massaging your liver, you're controlling your bladder, you're moving your bowels. Like, it's like all the things that we know are happening day to day, but we don't realize how much our body needs to move to do that. And one thing I love about belly dance is that we're moving in different directions, and we're taking the natural movements that our bodies do as women anyways, and just accentuating that. And that really, I believe it helps women connect with their feminine energy, which, living in a masculine dominated world, we're taught to like shut it down and hide it and be afraid of it. And having that safe space to open that up, I think, is huge. But like literally from head to toe, that the belly dance is healing for every joint in your body. And like even the posture that we do, you're not putting yourself in these like weird contorted positions that are actually going to put harm on your joints and your muscles, but actually help to heal them. So yeah, I have to give all that credit to Zada.
Yes, our master.
Yeah.
And also energetically, because there's a lot of energy. You see women that are, because we all have both energy, masculine and feminine. And sometimes because of the society where we're coming from, our backgrounds, whatever, make us like orbited in the masculine area.
Yeah.
And you see the shift of women coming back to their feminine area, the feminine energy in a very balanced way.
Yes.
And you see them like glowing and blowing and be feminine and feeling beautiful in their own skin.
Yes.
And that is thanks to the dance, because one of the most beneficial dance for women is the belly dance.
It is. Yes.
And has traveled. Many people think like it's Arabic or is from Middle Eastern. Actually, it's from Africa.
Yes.
It's born in Africa, but traveled so many times. That's why we have so many different types of belly dance, because everybody adopted for the benefit, for how great you feel, and people want it. Women want to keep in dancing. So we have all these different branches, but it's like the same. And in the bottom, take care of your uterus, take care of your womb, take care of your women energy.
Yes, like your womb, your heart, everything, and it's all connected. And to kind of piggyback off what you're saying, like, you know, as the like if you look at different tribes and cultures in the African continent, they have very similar moves to a lot of our basic moves, which means we've been doing this forever. Like our bodies are made to do this. But the other thing along with that is that our body holds our emotions and our traumas in different areas.
Wow.
Like our hips hold a lot of stress and grief and things. So a lot of time, and trauma. So a lot of times when women start moving these areas where there's been stagnation, whether it's, you know, that's how fibroids are formed, just from like the imbalance of the hormones. But we're literally sitting all day, whether it's in a car, at a desk, on the couch. Our society, we sit until everything gets stagnant. So when you start moving, all those things start moving and flowing. Our cycles can flow better during menopause. Like many women think they're in perimenopause or menopausal, and then they start dancing and boom.
Yes.
Their cycles come back. A lot of women dealing with endometriosis or fibroids, like those growths are happening because there's the blood flow and a lot of things are stagnant and kind of just sitting there. The energy is also stagnant. So when you start moving, those things start flowing, but then also there's this emotional piece that comes up as well too. So it's a very healing.
Many women, the first part, and I'm sorry that kind of interrupt you.
No, you're good.
The first thing that they notice when they do belly dance is the physical benefits.
Yes.
Usually they don't see the emotional. The people around them can see it better.
Yeah.
But they just see the physical part. For example, for me was like my period. My period was always painful and long period. And but when I started belly dancing, everything like become normal, become more easy. I even was dancing while I have my period. I was doing recreational activities that before I wanted just to stay home because I was so painful and I was so miserable. But with the belly dance, I was able to maintain my life even during those days and enjoy life. And the emotional, most of the time, what you see is like these women taking care of her.
Yes. That's a huge piece.
Exactly.
Yeah.
Like you walking straight with her chin up. And you are like, what is going on with this lady? She came so into her cocoon and they just go out and bloom.
Yeah.
And those are one of the things that I have seen for years teaching with you. But also you are very good to like let them know and guide them while we are in class.
Yeah.
And I also want to ask you because like I say, throw out a little bit of that there.
Yes.
How your career working with women and belly dance, how help you to find yourself? Because we also need that, like,
yes,
we are breathing here.
Yes. So it's interesting because I ended up in Sunyata's class randomly because a friend was like, hey, come take this class with me. And I said, sure. But I can tell you that the level of healing that happened within me dancing over the years at Mamacita's was like mind-blowing. I had gone through a very toxic relationship that had really scarred me and left me with a lot of trauma, and definitely didn't feel confident within myself or my or sexually. Like I didn't feel connected to that. So there was a lot of healing that happened there. So I always like to really allow women to feel like they're in a safe space because I feel like society kind of pins us against each other a lot. There's a lot of comparison, a lot of, one has to beat the other or competition. But in our belly dance classes, it's always been a safe space, a sisterhood for women to come together. So using that experience and teaching from Sunyata, and then working with women with pelvic floor issues, I've been able to really bring those two worlds together in ways that sometimes my patients don't even realize that I'm giving them belly dance moves, quote unquote, as like their exercises for home. Because by the time a woman comes to me, they've already been through, they've been having issues for a long time that they've had to keep quiet about. Then they're having to deal with doctors who won't listen to them or even won't give them what they need. Like a lot of times they're like, I had to ask to come here, and I'm so grateful that I'm here. So I always make sure that women know, even in physical therapy, this is a safe space. Like I educate them the same way. Like, hey, you've been through a lot. I'm going to acknowledge who you are and that you've been through a lot, and we're going to work through this together. And I don't force anything on anyone because everyone has their own story, and it's not for me to necessarily know. I'm just here to guide through the healing process. So I feel like I've incorporated a lot of what Sunyata taught us into how I practice as well, and then just educating women on their bodies.
Wow.
And empowering them with that, because knowledge is power. And when you know what's happening, that brings down your anxiety, that gives you the power to do the work that needs to get done and understand why you're feeling what you're feeling. So I feel like this is like my life calling, and I love it. So,
and I feel like that information needs to be for women that are also very young.
Yes.
Because when you are 14, 16, I know that it's tender sometimes to talk about those things. But the thing is, like, we arrive to our late 20s without knowing everything that is going on. We just know a little surface of knowledge of what they teach us, and depending of the family that you come from, they don't talk about like things that happen to you emotionally, physical, and taboos, traumas that are not talked and are passed to you.
Yeah.
And then that's something that I felt when I did the training for doula. I wish I could have all that information before having my kids.
Yes.
Despite I did the training for infant and toddlers who like in Montessori, which helped me a lot, but there's a lot in the gestational area, in the delivery that I probably will do differently. I definitely will do differently, and that will benefit me way more. My recovery and everything, despite what's okay, I feel that could be better. I could do better.
Yeah.
Having all that information.
I 100% agree with you. I haven't thought about it too much, but I feel like because adolescent is the very beginning of when our hormones shift and we have no idea what's happening to our bodies. I mean, like we're still children when we go through that. And so I think having a space for young girls to learn about their bodies and what's happening, changing. Because a lot of times young girls are battling with their mothers, you know, and I don't know, I can't speak for anyone but myself. I know there was times when I felt like I didn't know why I had the reactions that I had. And if I could understand that, it would make more sense, you know? And there was many times when I felt alone because the person who I love the most, who I'm expressing myself the most, who also doesn't understand me and what I'm going through at this time. So I feel like it's a very confusing time for young girls, and then that's not even scratching the surface for when you start getting male attention.
Yes.
And not knowing how to empower yourself to feel like you can be a woman, but then also carry it in a way that's powerful and not having to please others.
Exactly.
Yeah.
When and that is something that Soñara used to tell us a lot.
Yeah.
Like your real power starts when you learn how to say no.
Yes.
Without guilty.
Exactly. Yes.
Without guilty, without feeling bad, because you want to say no.
Yeah.
And because you step up for you and your body and yourself, and you say no. For whatever reason, it doesn't have to be to a male, but in everything, in your job, with relationships, food, whatever, you just say no.
Absolutely. And that's such a huge point, because we are taught to say yes to everything and everyone, and we are super women and we can get it all done. And that is not true.
It's exhausting.
It is.
That is the part.
I still struggle with it, but it is exhausting.
It is exhausting to please everyone, to do everything that the society wants us, just for give you like a round of applause. Oh, you are the best. You do everything. What I'm getting?
Right. And what's the cost? Exactly. The cost is self-sacrifice.
Exactly.
You're in pain, you're exhausted, you can't focus, you're irritable. And the people that you love and want to spend time with, like you're just in a bad mood. And it's like, no, this doesn't work.
And it's normalized.
Yes.
It's normalized that after you have babies, you don't take care of you, that you have a lack of sleep. It's normalized that you don't take care of your body, that you have so many issues. Oh, that's because you're a mom, or that's because you are a mom of teenager. That's normal.
Yeah.
You should feel good.
Exactly.
You should thrive.
Yes, and take care of yourself.
Exactly. And talking about that also, Nicole is also a wife and a mom.
Yes.
So how do you balance all that with being a mom and a wife? Because it's a lot of work. People don't realize marriages are a lot of work.
Yes.
Marriages are a lot of work.
A lot.
And being a mom in a healthy marriage is a lot of work.
Yes, it is. Yes, it is. And I think that is not spoken about enough either.
Yes.
We are taught from little girls
Mhm.
that like Disney, like happily ever after, Prince Charming's going to come and sweep you off your feet and then you're going to live happily ever after.
That's why they stop the movie when they get married.
Exactly. Exactly.
The movie ends right there.
Right there.
They got married. Boom.
Right.
The end.
And that is the beginning. That is the beginning of reality. And I will have to say, it definitely takes a lot of work, a lot of patience. And honestly, it takes a lot of self-reflection. I am not perfect. I'm still figuring it out. I don't feel like, half the days I feel like I'm failing anyways, but I know that I'm not, you know. But I think that it takes time to be able to connect and communicate with your partner, because they're totally different than you. And I realize a lot of what I do is expect myself out of him, and that's impossible. So I'm learning how to keep space for him to be him and not expect him to do things the way I would do them or what I would do. You know, like whatever he's doing, I'm like, thank you for doing it. And just learning to be more grateful and all of that. And I would say one of my biggest struggles in life has been the whole people pleasing and breaking that stigma for myself and learning to say no and being powerful in my no. But that's hard to do as a mom, as a wife, and as a professional, where I'm constantly taking care of people.
Yes.
You know? So one of the biggest things that I have to do is make sure I get my self-care time. Because if I don't, I'm teaching my daughter, it's okay to sacrifice yourself for everyone. And I'm teaching my husband, you can do whatever you want, and I'm here to take everything, but not receive. And
you're reinforcing that.
Yes.
Continue doing your behavior, my dear. I will be here no matter what.
Right. And it's not like he's doing anything bad. He's just being himself. He's setting those boundaries and doing those things for him. Like, he'll tell me, no, I can't do that. And I'm like, initially I'd be like, what do you mean you can't do that? And now I'm like, oh, I get it. You know, you're right. You can't. And I can't do this.
Exactly.
So it's finding that balance. And I feel like it's just a constant work in progress. Nothing's ever perfect. And there's really no right answer. It just is.
No, and I really like that you say that, because that is something that in Vida en Espiral, Life in Spiral in English, we have been talking a lot about the habits, about take care of you, about to grow with your kids.
Yes.
Because
that's
some
huge.
societies and some cultures and families have taught us, like, take the time for you, advocate for you as a mom is selfish.
Right.
That is the word. It's selfish. How dare you go and do this with your kids? Because you're a mother of two. You're a mother now. But who said that you don't have to take care of you?
Yeah.
And this kind of conversation, I'm a sacrifice mother, I do everything for my kids, are also programations that we do in our minds.
Yeah.
To live like that and live in the burnout and think that it's okay. And look how you say, like, something that you do every day is take the time to take care of you. And that makes me admire you more, because that is something that I always say, and I'm doing it myself.
Yes.
And I want everybody around me realize it and do it, because that makes healthier women. When we take care of ourselves, we also put down a little bit the competence, and the how can I say, like, envious, or like the negative thoughts about other women in this case, because there's a lot of women competing with other women and seeing the other like my enemy. But when you do all that work, you see the other one like, how can I help you? Is there something that I want to do that I can do for you? Because you're already taking care of you.
Yeah.
You are able to see the good in others.
Honestly, I 100% agree. And you are one of the people that I like model or admire for how consistent you are
Oh wow.
about yourself.
Capricorn.
Yes, it's very
Capricorn.
true.
We are boring in the zodiac, but I'm so agree that we are routine
Very.
people.
My husband is a Capricorn. I see it. You guys are on it. And so just seeing you really motivates me.
Mhm.
Like when I saw you, because you had both of your children before I had mine,
Mhm.
and is watching you go through your pregnancy and your postpartum and seeing how diligent you were about making sure you took care of yourself,
Mhm.
that actually taught me, okay, yes, it's okay to do that, because I didn't see that growing up.
Mhm.
You know, so when I get into my, because I get into those spaces too where I'm not as consistent, and I realize, oh, my mental health isn't good, my body doesn't feel good, these things, I need to get back to the things that make me feel good, and do that consistently. And like between dancing and talking and our friendship, like I see you do this very regularly. I'm like, I need to channel my inner cloud. I need to get up at 5:30 in the morning and do my workouts.
And let me tell you, that looks very different for everybody.
Yeah.
What's workout for me, for example, I work out from home because since 2020, I was at home like everybody. And for me, has been convenient. Wake up, put on my clothes, and I'm here at home. And I start to build it on like my small gym. But for some people, work out to go to a gym. If it's the gym that works for you, go, because they need the social part and motivated with other people. You don't feel okay by your own, but do it. Like, and if it's CrossFit, or if it's dancing like Zumba or whatever other gymnastic or whatever, do it, but find the movement for you.
Yes, I totally agree. And I think it's like you have to find how it fits in your life. Like when I give patients exercises, I'm like, how are we going to fit this in your life? Like, you tell me what works for you, and I can help you with that. So even for me, like, as long as I got like my little 5-minute meditation, like whether I'm dancing and singing in the car by myself or something, every day has to happen for me.
Oh my
just
gosh.
for me. And it like, so that way it takes away the pressure of, oh my gosh, I didn't get up and do my workout, because I will go through that mental piece, and I'm sure a lot of people have that as well. So once you find that one thing, like you're like 5 minutes every day, and that 5 minutes grows to 10 minutes, and that 10 minutes grows. So you start feeling the empowerment and the self-care and the self-love. And you're right, it totally cuts out comparing yourself to anything or everyone else, because it's that mind shift.
And something that people don't know is like everybody that is thriving in their self-care start very small.
Yes.
And that is what I'm saying. Don't compare yourself with people that have years taking care, because start with a little walk every day, maybe.
Yeah.
Or start with changing your habits of eating. And then because there are people that start with the food habits and then exercise. There are people that start with exercise and then food habits. There are people that start with a yoga class.
Yeah.
Once a week or once a month, and then went through all the things. So it looks different for everybody, but start today.
Yes. And even if you fall off, just start again.
Exactly.
It's not hard. You just start right back. There's no measure, and there's nobody to compete with to say what's right and what's wrong. Like, each one of us is an individual.
Yeah.
And we're in charge of ourselves. And it's also our role to teach our children to be in charge of themselves. So they're going to mimic everything that we do.
Yes.
And listen to nothing of what we say.
Yes, that's another thing. What are you saying? I wonder the people find you. How can people find you, Nicole?
Oh,
because these women is amazing. Once you have pain and cheap, like with the trigger, you are going to hate her thumb.
Yes.
But the benefit of her therapy is amazing. So how
Thank
can
you.
people find you?
So I'm on Instagram as Nicole Kabia Smith, and also I have an Instagram page and a website. However, I haven't really built the Instagram page yet, but it's soulwellnessstudio.com. So yeah, I can give you the information.
Yes. Soul Wellness is recently, it's like your most recent baby.
Yes, it is.
That's
it
why
is.
it's not build it up. Hello.
But it's coming. It's coming soon.
Yeah, it's your own practice.
Yes,
under your own
it is
terms.
Yes.
Lady, so proud of you.
Thank you. Thank you.
Yes. So I will put all the information. Remember to comment.
Yeah.
Something powerful that you want to, before we close this amazing conversation, because we can go on and on. To say to the women, to the crew, because the podcast is also listened by men and everything.
Yes.
But if you could tell a message to those people, what that, like moms or single dads, or like even single women that are finding their path, because I feel that like we met for so many years, we both have seen us crossing things and walking since you were single, for in my case.
Right.
I met you while you were single. You met me as a newlywed.
Yep.
And we have been walking all these, like leaving our 20s, entering our 30s, leaving our 30s.
Now I'm in the 40s.
Yes. And has been a lot of changes in our life, become moms, like postpartum, blah, blah, blah. But when you met somebody like in more than a decade, that you see all those Nicoles, and you have seen all those Claudias. Yeah. What can you say?
I think the biggest takeaway I would say for people is to honor, respect, and love every version of yourself, male and female.
Oh, wow.
Because we didn't even touch on it, but men going through the similar transitions, theirs is totally different from ours, but they have those too. So I think that the biggest thing is always honor and respect and love each version of yourself, and know that each day you're going to be different. Yeah.
I want to hug you.
I know.
So with these big thought and powerful words, we'll say goodbye to our episode with Nicole. Dr. Nicole Kabia has been I can say the first word that came to me was delicious.
Yes. Thank you. This has been phenomenal. Like, I've had such a great time, and I'm so excited for your podcast. You have such a great message.
Oh, thank you so much. So look for Dr. Nicole Kabia and Soul Wellness in Instagram. Follow her and check her website, and tell us what do you think about it in our comments. So this has been Vida en Espiral, Life in Espiral in English, with your host, Claudia Simasek. Bye-bye.